Let me answer that. I'm 13 years old. I go to the doctor. He says I've got a bad heart valve. He tells my mother, we have a cure. We're going to cut his heart valve out and put a pig valve in there. And I said, Doc, how long will that give me? He said, oh, Bert, that'll probably give you 6 or 8 years. I said, Doc, is that the best you got? You're going to put a pig valve in me and give me 6 or 8 years? And he says, why, sure. And he said, if that doesn't work, he said, by then we may have new technology. And I said, Doc, suppose the technology is I wasn't supposed to have the heart valve. By the way, seen any really good pigs around? I mean, like, really good? Here's the problem. Am I anti-doctor? No. I'm not anti-doctor. There are a few good ones out there, somewhere I'm sure. I know a couple of internists here in Tucson and a couple of surgeons that really do care, but they are very far and few between. It's about care or it's about money. You see, they have to work according to the standard of care. They can't vary outside of that. And they'll tell you that, oh, this is the treatment I would give my family. But you know they're lying. And the other thing is that they'll say, well, I really didn't want you to have to take that chemotherapy anyway. However, their standard of care says they have to tell you that. So is it your life that's important or their standard of care in their profession and making money? So I call them mercenary. To me, there's good doctors and bad doctors. You know, there's the old one about the general practitioner who knows a little and does a little. Then there's about the surgeon who knows some and does a lot. And then there's the one about the true doctor. That's the pathologist. You know the pathologist, he's the one that knows everything and does everything. He just does it a day late. So the biggest thing I can tell you is the difference between God and a doctor is that God knows he's not a doctor. But no, I'm not. I just know that doctors are trained for the most part by big pharma. And that they're taught by these little cute little female or male reps who go out there and have been taught a little bit, don't need to have a license, and they can sell the doctor the drug, but you and I have to have a prescription to take it, and it's got more side effects than what it has. Well, if I'd have listened to those doctors, I wouldn't be here today at 62 years old. And I've been working with people all of this time for years with thousands and thousands of patients and seen many of them restored. So how can you go to a doctor? I mean, just let's ask who's stupid here. How can you go to a doctor and say that you're going to go to a doctor to get cured of a problem when he can't guarantee you how to prevent it? He doesn't know enough. You know, according to their oath, they should do no harm. They should never ask you to take any deadly thing. That means anything with a bad side effect. Check that out. The other thing is that they're supposed to give you nutritional counseling. Of course, that was before 1964 when the oath was changed at Tufts University, when now what they do is they can say, oh, well, we may even have to take a life, and that's okay. We should do it with responsibility. I can only say it, not in my family or not with my friends, because that's what people pay me for. You see, that's why people pay me to be a healthcare advocate, to question the doctors, to take care of their health, to safeguard them, to give them another line of thinking. So here's the thing I'm going to say is that, am I against doctors again? No, I'm only against stupid doctors. And I'm going to tell you how you know if a doctor is stupid. Okay, first of all, you can know that if he can't get in shape and tell you how to get your body in shape exactly in minimal time, test it and prove it, then he doesn't know much about the body. And you're going to ask him to care for the rest of you. He's going to cover it up with some type of masking symptom and give you immediate relief so that he can sell you another drug down the road. Well, let me ask you this. If your doctor can't tell you to do these things or help you with these things I'm about to tell you, which we do every day, and we see other people do every day, if he can't help you with these things, your doctor is stupid. And I mean it to the truest word. Look up Mr. Webster. He'll show you what stupid means. If he can't lower your blood pressure naturally and help you to keep it down without medication, lower and balance your blood sugar levels, teach you how to balance your triglycerides, lower your cholesterol, if he can't help to stop your menstrual pains and cramps, if he can't help you with menopause and all the side effects and the symptoms of hot flashes and so on, if he can't help your child with growing pains, if he can't help you with excess stomach acid, if he can't help you to lower your allergies, if he can't help you to relieve any of the asthma symptoms without medication, or if he's giving you an aspirin to thin your blood when unpasteurized vinegar would do it and help you to get excess sodium out of your system, or you can't do it with vitamin C, which would 500 milligrams of vitamin C would extend the average person's life by 5 years, or some vitamin E to thin your blood, or fish oil. He's got to use an aspirin, which can cause, you know, different types of problems with your pancreas and all the other organs in you. If he's not doing that, if he's not fixing it and restoring it, then he's financing something. And I don't think it's you. You ever go into a doctor's office? Let me tell you, 3 years ago, I went into 10 doctor's offices to see how I would be greeted. Without exception, every time it was, do you have your insurance card? What type of insurance do you have? Or who is your insurance provider? Never once was I asked how I cared, or what was wrong, or what's my symptoms, or do I need immediate help? So only thing I can tell you is that am I anti-doctor? Who's stupid?